Hello, good evening, and a very warm welcome to this Calf Crop 2021 webinar. This is webinar 4, which is Assistance and Antibodies. This meeting is brought to you by SEC Consulting Livestock Team and SRUC Vet Services together. It's funded through the University's Innovation Fund. The Calf Crop programme, basically you'll have seen this before for those of you that have been on these webinars in recent days, but just to run through very quickly, the aim of the programme is to get current key research messages out to farmers, out to where it really matters, improve overall suckler cow performance, produce more calves, and ultimately make more money for suckler producers. The team for calf crop this year, as many of you will know, is made up of 2 from the vets and 2 from the livestock team. So from the vets, we've got Tim Geraghty and we've got Alwyn Jones. And from the livestock team, we've got Karen Stewart and myself, Robert Ramsey. So the format this year, obviously, we've gone virtual and we're all on webinars, as you know. And the webinar series, really, we're trying to look through the kind of productive system, the annual system that we've got. So we've got 5 webinars in the spring, looking at and around calving time, and then 2 in the autumn, looking at weaning and management at weaning time. So we're now on to webinar 4 of 5 in the spring, and certainly hope you've enjoyed them so far. We've got a good turnout again tonight, which is always a good sign. But today we're probably at the sharper end of things, onto assistance, onto calvings and colostrum management as well. So as I say, meeting 4, Tim Geraghty is going to cover calving and colostrum, and Alwyn is then going to go on and look at calving the cow and resuscitation of the newborn calf. And again, after this kind of success of the last few panel sessions we've had, we've got plenty of time for questions at the end. So we would encourage all your questions, and please make use of the question panel on the right hand side. Put in any questions, they just come to me. There's nothing to worry about. It's all confidential. I'll field the questions, chair the panel session, and hopefully get all of these answered. For any questions we don't get answered, we'll package all of them up and they'll be answered in the middle of next week. So before we start, so we've got 2 vets tonight who are going to focus on calving and on the stuff that, you know, the calf survival, calf welfare, and for me that's very important. It's hugely important for the success of our businesses and certainly for bottom lines. But the most important thing has to be your own safety. That has to come first with everything we're thinking about. I covered this in webinar 2, but just tonight I wanted to cover it now. Just basically, before we do all of the stuff the vets are suggesting we do, we have to make sure that we're our welfare isn't compromised at all. So on average, we're losing 2 people per year, based on deaths caused by newly calved cows, and for me that's certainly too many. Don't take chances. As I say, we've had really good turnouts at these meetings, and I hope that means we can have a calf crop 2022, and I also hope that you're all still here to be at calf crop 2022. So certainly keep all that in mind. All cows are dangerous. The quiet ones are probably the most dangerous. You know, the ones that they've never done it before, but we should keep our eye on them all. I think we need to get to a point where we're minimising the level for the level of intervention in the first place. So can we eliminate intervention? Probably not, but we can certainly develop systems that minimise it or minimise the need for it. And while we're trying to minimise it, there's always going to be a need for it. So we need to develop safe and effective systems to do these jobs that are safe for both man and beast. The biggest thing for that is I think we should all, regardless of your system, we should be culling really hard for temperament. So anything that's looking at you the wrong way or causing problems, I think has to go. The Calf Crop 2021 webinar, the second webinar in the series, is there. It'll be uploaded to the website shortly, and it's worth revisiting. And also just to highlight again, Basil's video on the QMS MooTube. It's got some really, really good hints and tips just to simple things you can do to improve systems and make a big difference to what you've got. So that's basically all from me on that, and I would just like to pass over to Alwyn just now, to Tim just now for his presentation.
Thank you. Thanks, Robert. Thanks, everyone, for joining. Just give me a second now and we will get the screen set up, hopefully. And if, Robert, you stay on and just let us know that it's working, that would be good.
Yep,
yeah.
I can see it. Thanks, Tim.
Sorry, on the wrong slide, pardon me. Start at the end, that'll make it nice and short. Magic. Okay, thanks everyone for joining, and I hope, that's not what we needed. Thanks everyone for joining, and I hope there's something useful in the next 10 or 12 slides or so. Like Robert says, I enjoy the questions the most, and I think particularly this evening with a difficult subject like this, I think the comments and questions that you guys generate are likely to be just as valuable, if not more valuable, than the stuff that we'll cover in our slides. So we'll try to be concise. Robert mentioned in his introduction there that this series is about trying to bring latest research, knowledge transfer from the latest research, and it's really nice to be speaking on a subject now where there's been considerable research done by Scottish institutions on Scottish herds and English herds over the last 3 or 4 years. So the vet schools, Glasgow and Edinburgh, Livestock Health Scotland, ourselves at SRUC, have all been actively involved in research around calving and colostrum, and that's just great. So I'm going to try and make use of that information and bring it to you as best as I can. There's a danger there, it's my interpretation of what we're learning, but there's certainly new information out there, and I'll do my best to translate that now. We'll start here again. So this is the same picture we looked at last week and earlier this week. We have our pregnant cattle. I appreciate some of us are going already, but lots of us still to start calving. Pregnant cattle down in the shed here, and we are investing in them. We're feeding them money and spending our money on them in the hope that we're going to see a return on that investment later in the year. And the two things that the cow needs to do to give us that return is wean a big calf, that is a rapidly growing calf, and get back in calf quickly. So that's the same two targets we've had consistently now, and we'll keep that into the fore of our minds as we go into these two challenges here. Considerable challenges, they come right on top of one another. Challenge number one, of course, the calving is a physical challenge, really. It's just about getting this calf through the birth canal successfully, success for both the cow and the calf, and then start breathing on its own. So there's a physical challenge to start with, and then there's essentially an infectious disease challenge immediately afterwards. So this calf, as soon as it hits the ground, let's be mindful that it is facing an enormous environmental challenge. Even in nice, clean, newly bedded straw like this, there's an enormous amount of bugs and bacteria that are just waiting to get somewhere to grow. It's got a direct opening to the bloodstream and to the liver by way of the navel, so the navel is wet, bleeding and open. It's cold, it's wet and it's hungry. It's potentially sore, bruised and confused to boot, depending on how the calving went. And it's got no specific immunity, and that's the greatest challenge of all. It's got no specific immunity to any of those bugs that we have talked about. So, and to make matters worse, rather, there is a clock ticking for it to get some immunity. And of course, it's colostrum. It's that first feed of colostrum which delivers immunity, but there is a limited time window for it to do so. And the clock's ticking. By 6 hours, that window is substantially reduced. By 24 hours, it's no longer able to absorb any antibody at all. So two very high-risk situations. And as a result, and unfortunately, probably predictably and certainly very well known, that it's a very common time then to lose the calf. That calf deaths become a particular problem around these two areas. We're lucky, the literature from Scotland, which as I say is relatively recent and focused on our own herds, would put that figure at about 5%. That's 5% of calves, between 3 and 5% of calves dying at this as from stillbirth or in the perinatal period. That's from two separate studies. It's not completely representative, but it's certainly a strong indication that we'll be in that ballpark. And that's quite a high cost for the industry to carry. Clearly, if 95, 96, 97% of pregnant cattle should wean a calf, then 3 to 5% stillbirth and perinatal loss is very high. It's not the whole story. We have substantial between herd variation. So calves dying around this time varies substantially between herds. And we can see that on this graph. So we're looking at 14 different herds. We're looking at stillbirths in the top graph and deaths in the first week, largely due to either a hard calving or colostrum failure in the second graph. But you know, the best thing, if we look at this graph, the best thing to focus on for me is the arrows. This is 2 years. Each farm's been in the study for 2 years. It's the Livestock Health Scotland calf crop study. Been in 2 years, and any down arrow means that it improved from year 1 to year 2. So down arrows mean that one herd improved from year 1 to year 2. And so we can look at this graph with some substantial optimism that wherever we are now, there is room for improvement in our systems, and there's success being shown in being able to reduce that. And some of these great big down arrows, if we look at herd I in deaths in the first week, moving from 6.5% crashing all the way down to 1%. That is, I know because I was involved in the study, that's the power of improving colostrum management can have in a single herd in a single year. So there's room for optimism that we can improve our systems 1 year to the next from this chart. Let's zoom in then on challenge 1, which is the physical challenge of calving. This is data taken from an Orkney study looking at the risks of stillbirth, and we're looking at calf survival rate. So a big bar is good. This is how many calves survive the perinatal period, and we're looking at that against how we assist at the calving, if we assist at the calving, and how the calving goes. And let's draw our eyes to the far right. Observed, so we watch the calving, but we don't get involved. 99% survival rate for the calf. So that's where we want to be operating. Observed, watched calvings, but unassisted. I'd like to draw attention to unobserved calvings. When we don't get to see them, the death rate there is 11%. So there's a 10% swing between the calvings that we watch and the calvings that we don't watch based on this study, and it just brings observation, stockmanship right to the front of our minds as so important. And if we observe and we can intervene, then there's a saving to be made. If we intervene well, we can reduce our losses when assistance is required, as we can see mild assistance having a better survival rate from that study. How often are we intervening? Well, 80% of the time we don't, which is okay, that's what it is. 20% of the time, 1 in 5 live-born calves do get assistance with the subsequent risks. That's from a separate study. This is coming out of University of Edinburgh just this week, brand new, published this week. And the authors describe when we assist this calving, we have an increased risk of young calf death, increased risk of veterinary and medicine costs, increased replacement costs on the herd, reduced colostrum uptake, reduced growth rates, reduced fertility outcomes. Everything we are trying to do, going back to our base challenge and our return on investment, is compromised when we are assisting these calvings. I'm not saying it's wrong to assist. I'm just saying when we assist, it's not where we want to be at. So our calving ropes might cost us 10 quid, but the costs of using them when we are forced to use them and we have to use them, there are hidden costs in our system there. Now let's look at the domino effect. So when we have assisted the calving, we're now going to look at colostrum. We're going to start thinking about that vulnerable calf lying in the straw. And there's a domino effect. So this is looking at the effect of intervention on calving and the immune competency of the calf thereafter. An Edinburgh study, again published last year, brand new, again based on UK, Scottish and English herds. And the scale here is immunoglobulin. So that is a true measure of the amount of antibody the calf has absorbed. And we're looking at the rates where there's been no assistance at the calving and the rates where there's been assistance at the calving. And we can see the obvious effect, much lower immunity when we have assisted that calving. So we now have a domino effect, not only a higher risk of stillbirth and now a higher risk of colostrum failure. How often does colostrum fail? Well, maybe unsurprisingly, given how often we're assisting at the calvings and the risk that poses. 1 in 6 live-born calves, this is a separate Edinburgh University study published last year, 1 in 6 live-born calves getting almost no colostrum, and 74% of our farms have at least one of those calves. and then 1 in 3 calves not getting quite enough colostrum. So they've got a good amount, but they didn't get as much as they could have. And almost all of us have at least one of those calves per year. So like we said in that first chart, there's room for improvement here. We can be optimistic and look at it as an opportunity to improve our systems. When we don't get enough colostrum, again, the authors draw our attention to an increased risk of death, increased vet and medicine costs, and reduced growth rates, challenging the economics of our system. Similar chart. So we are back looking at antibody level in the calf. We are now looking at intervention with colostrum. So not intervening at the calving, but intervening somehow, whether we have led her to the dam or given her dam's own colostrum with a stomach tube or whatever. And we'll return to this. I know Alan's going to return to this same chart. What I want to pick out on it is that the best antibody levels are when we don't do anything. When the calf comes up and sucks by itself, it achieves the highest antibody levels of all the other types of intervention. Now, those interventions could be right and essential and needed, but if our system is forcing us to do that a lot, then that's a problem. Our system should be maximising how often we don't need to intervene, because that's where the highest antibody levels be achieved. A quick slide on known risk factors and established risk factors, and again, this work collectively would point to this. For both needing assistance at calving and the negative outcomes that brings, and colostrum failure and the negative outcomes that brings. So male calves are at higher risk, heifer dams, heifer mothers present a higher risk, and twins present a higher risks. So we can know that, we know where our heifers are, and we can risk manage that and think, okay, we know we need to maybe intervene earlier there and do something about it. Likewise, we can and should know which cows are carrying twins, and be ready to intervene earlier. And we talked about feeding them separately, etc., in previous weeks. A couple of other established risk factors for needing calving assistance: breeding and genetics, of course, has a role, and that's comes through these papers. Having a large calf, so calves over 55 kilos, that's a specific measure just taken from one of the papers, but upper quartile calves, the biggest calves in the herd, the larger calves have an increased risk of assistance and subsequent negative effects. And low body condition score in the cow, increasing the risk of of an assisted calving. That's quite new. That came out of one of the Edinburgh papers and is food for thought. For me, what I take, well, we went on about low body condition score cows last week and the week before, and our last talk and the talk before, and we know they're bad for fertility, and now we know they're also bad for assisted calves. And of course, as we have seen, calving assistance, these risk factors drive calving assistance, and then calving assistance dominoes down and increases the risk of colostrum failure. So those same things, by the domino effect, will make colostrum harder. Great, okay, so what would we take then as our final summary if we've got all this new literature and information, and I've tried to summarise it in some meaningful way? I would take as a practical message that comes out of this: observation is vital. Stockmanship and close observation of the calves, this is of the cow. This is an extremely high risk period of time, extremely high risk window, and we need to be as watchful as we possibly can. And think back to, we're talking about cameras and being able to check the shed from the bed. Fantastic that these things are there to help us and can make a huge difference in our ability to observe without getting involved. We can use our risk factors. We know where our heifers are, we know where our twins are, and we know that they're going to be higher risk. So observation and stockmanship comes right to the front. When we can observe and not intervene, we get the highest outcomes for welfare, the highest calf survival rate, the best colostrum uptake, the best growth rates, and the best fertility outcomes. When we watch but don't intervene, that's where the animal does best for our business. And so all of our businesses, wherever we are just now, we should be aiming to increase the proportion of cows where that happens. 1 point every year, 1 percentage point improvement year on year on year. We want as many as possible to be observed and not intervened, because that's our most economic outcome, our best outcome. That said, it's such a high risk period, we won't always achieve that. There will be times when we need to intervene, and so when intervention is needed, then doing that safely can substantially reduce losses. So we're ready to go. We're going to intervene and do it well, but it is about reducing losses at that point. That's not the economically optimum way to be doing things, but we can still make a big difference if we get in there. And I will then pass to Alwyn now to allow him to tell us how to do that. How do we intervene best to reduce losses when we have to?
Oh, 1 second. Can you hear me and see the slides okay?
Yep, both.
Yeah.
All fine. Thanks.
Great, right. Okay, go back to that. Okay, thank you, Tim. And good evening, everybody. So as Tim highlights very well in his presentation, our target should be, not to, for no assisted calvings really, but in many situations, intervention is necessary. And tonight, I want to talk to you about calving and when to intervene, and some of the best practices when you are intervening as well. So first of all, I just want to, and I'm sure you all know this, but I think it's just to help with the rest of the presentation is useful to maybe just go over the stages of calving. So calving is broadly divided into 3 stages. You've got stage 1, 2, and 3. In stage 1, so stage 1 is a period when the cow is preparing for the stage of labor. And during that's a period when she's seeking isolation. She's restless, she's showing signs of pain. She might be kicking at the belly. Quite often they hold the tail head up. It's a stage that lasts about 2 to 6 hours. Sometimes in heifers it can last up to 24 hours. Sometimes in cows it might not see stage 1 at all. It's very short. The plug in the cervix as well is released at that point, and the discharges from the vulva becomes more liquid. And then you move into stage 2, and this is when the water sac and the calf enter the birth canal, and the presence of that in the birth canal causes forceful contractions. And during this time, the cervix is fully open, and stage 2 lasts 30 minutes to 4 hours usually. And then the final stage is after the calf is born, where the afterbirth is expelled, and that can take, that should occur within 12 hours. So when is the best time to intervene then? And that is it's a difficult question to answer. And we really want to avoid intervening too early to begin with, because one reason in particular, if you intervene too early, particularly if you intervene during stage 1 and disrupt that process in stage 1, you can halt the progress of calving, you can prolong the process of calving, and that can increase the risk of the calf being born dead. Equally, you don't want to intervene too late as well, because obviously that can increase the risk of problems in the cow and the calf. So intervening at the right time or trying to intervene at the right time is important. And there are 5 rules of thumb here that are useful to kind of to help you know when to intervene. So the first one is in stage 1. If she's been in stage 1 for over 8 hours, then it's worth intervening. Now the caveat to that is sometimes quite difficult to know when she first went into stage 1. So that's, and if she's not observed regularly, and ideally observed via camera so you don't disturb her, it's hard to know exactly when she went into stage 1. But if you know she's been in stage 1 for over 8 hours, then I would intervene. The second point, the cow is now in stage 2, but if there's a water sac been present for over 2 hours and there's been no progress, then I would suggest you intervene. The third point is if the cow has been straining for over 30 minutes, but she's not really making any progress, that's another point to intervene. Now, during stage 2, something should be happening every 20 to 30 minutes. Okay, so say you see a little bit of the foot out, in 20 to 30 minutes, there should be a little bit more out, and in another 20 to 30 minutes there should be a little bit more of the leg out, a little bit, some of the head should be coming out. There should be some progress being made every 20 to 30 minutes. So if she's been there for 30 minutes and not making any progress, then I would intervene. The fourth point refers to the breaks between the periods of contraction. So normally a cow will have a set of contractions and she'll have a break for about 5 to 10 minutes. If you notice that these breaks are becoming longer, like 15 to 20 minutes, then it's usually a sign of fatigue in the cow, and it's worth also intervening then. And the final point is, if the cow is also is again showing signs of excessive fatigue, could be you could be running into problems with low calcium. If the calf, you can see the calf head and it's swollen, the tongue is swollen, that's obviously time to intervene. And if there's a lot of blood as well, that's also time to intervene. Okay, a few points I'd like to make to emphasize before you start. First one is to do with hygiene, and I think hygiene at calving is important, and in particular to reduce the risk of uterus infection after calving. So that's the main. So through which can occur if you're carrying fecal matter or dung on your hands and arms into the uterus when you're intervening. So just some hygiene precaution, kind of move the tail out of the way, get someone to hold it out of the way, or even tie it to the side of the cow's leg. Probably don't tie it to the side of the crush, because if for some reason, if the crush door opens and the cow gets away, then you could cause injury to the tail. Clean around the back end, clean around the anus and the vulval lips before you put your hand in. And also if there's bits of the, some of the calf out, quite often the cow was, kind of dunged on the calf's head, etc. So clean that bit. Clean your hand, wash your hands and arms, or wear gloves. Gloves is probably preferable, and get a pack of those arm length rectal gloves. And then think about the bedding this calf is going to land on when it's born. So clean, dry bedding for the calf to lie on. Second point I want to make is about lubrication, and there's three things here I want to say. It's like you can't use too much lubrication. It's not harmful, and it's relatively cheap to use. So I find one problem is that people reach for the lube bottle too late. Use it from the start, kind of take it in with you from the start. People tend to reach for it once things get stuck, and at that point it's quite difficult to get the lubrication between the calf and the pelvic canal, like between the birth canal. So use it from the start. There's two main types, and you can get the stuff pre-made, but I think that you can get powdered stuff called J-lube, and I think it's better in my opinion. And one benefit of that is you can mix the powder with water, and you can make a large amount of lube. So a small amount of powder, you can end up making a whole bucket of lube if you wanted to. And if you want to, one tip in order to be able to help get more lube in there is to use an old stomach tube and pick a stomach tube without a sharp end or rough end, and you can pour the lube into the bag and use the tube to feed in the gravity, and you can get the lube where you want it much easier using that method. And the final bit I want to say is about the water sac. So there's two water sacs. Okay, the first water sac is what breaks during stage 1, and you see the water that comes out. The second water sac is the inner water sac, and it's a bluey grey colour water sac. Don't burst that water sac until it's time to put the calving ropes on. The calf is absolutely fine inside the water sac as long as it's got its umbilical cord. It'll be fine. The fluid around the calf keeps things mobile. But the other benefit of having the water sac there as well, it's almost like a balloon ahead of the calf, and it pushes against the cervix, and that kind of water sac against the cervix helps to open the cervix. But if you're bursting it too early, then you're losing the benefits of the water sac. So before you start, and before you apply, start pulling, I think it's useful just to take a step back and just take your time. Calving is a slow process, okay? So there's no real rush, in my opinion. So take your time. put your hand in and just feel and assess the situation. Feel the birth canal. Okay, does it feel narrow? And if it feels narrow, you might run into problems. Feel the cervix. Does it feel dilated enough? And if it still feels quite narrow, then I would suggest you leave her for 20 minutes and come back and check her again. And if she's not making progress in that it's not dilating, then I would suggest at that point calling the vet, because it could be that you've got a tight cervix, it's not going to open. Sometimes you do kind of run into these problems, like almost like ringworm. Or it can sometimes be a sign of a twisted uterus as well. Assess for where the calf is positioned. Is it the right way up? Is it upside down? Is it coming the right way, head to front feet, or is it coming backwards? Is there more than one calf there? Assess, can you tell if the calf is dead or alive? One thing is you can pinch it between his feet, between his toes, between his hooves, and they should, pull back. You can gently tap on the corner of the eye. Sometimes you'll feel it blink, or sometimes it will suck your finger as well. And you can sometimes have a feel of what kind of size it is. Now, studies have shown that, the thickness of the legs does not correlate very well with actual size, but I still think it's worth kind of feeling the leg and seeing, okay, you can get a vague kind of assessment of how big a calf you're dealing with. So if the calf is coming in the forward presentation, so we've got head and 2 front legs, there's a good chance of a successful delivery, by pulling the calf. If the head and the front legs have been brought into the birth canal, and the fetlocks of the calf have been brought beyond the vulva without you having to do anything, then that's a good predictor. So, for example, this picture here shows what I mean here. So if the fetlocks are outside the vulva, head and feet are in the canal, head and legs in the canal, then great. That's the first thing's good. The second thing is if the hooves, so I'll move to this one. So when the cow contracts and you see the hooves gliding in and out, okay, so when the cow contracts, hooves glide out, and then when the cow relaxes it, they go back in. So if it's gliding back and forth, that's a good sign. If it's sort of rigid in place and not moving when the cow is contracting, then that's a bad sign usually. The third thing is the calf is in the canal, so the head and shoulders are in the pelvic canal, and you can fit your hand above the head. So I'll move back to this picture again. So if the head and legs in the birth canal, and you can fit your hand right over the head to the back of the head, then that's a good sign. If you can't get your hand over the head, then that's a bad sign. And the final bit is that the front legs are not crossed in the birth canal. So go to this one again. So if you're noting that the calf is there and the front legs are crossing over, then what that means usually is that the shoulders are too wide to get into the birth canal and they've been pushed together and the front legs are crossing. So those are the 4 things that are predictors of a successful delivery. When you're applying traction, okay, I prefer you to just use human power, and 2 people pulling is best. If you're going to use a jack or a pulley, then use them with care. You want to apply traction when the cow contracts. Okay, so they meant, it's to help the cow along really than to pull it out. When you're pulling, so you want to be pulling initially horizontally, okay, until the head and shoulders are out. And once the head and shoulders are out, you pull in a slightly downward direction. One good thing, if you can't do it, is to twist the calf. And the point I would suggest you do this is when the shoulders of the calf are out, is then to wrap, if you can, wrap your arm around the calf and try and twist the calf. And the purpose of this is to try to twist the calf enough so the hips of the calf twist to about 45-degree angle, and so that they pass through the cow's pelvis at the diagonal angle, at a 45-degree angle. And that's because the widest part of the cow's pelvis is diagonally across. Okay, so if you can get the calf to twist, then better. It's a difficult thing to do, and it's not necessary in every case, but if you can do it, then it can help. Okay, if the calf is coming backwards, I mean 2 back legs, I don't mean breech here. So if you've got 2 back legs and tail, like this one, the critical bit that must pass is the hips. So the hips have to be able to pass a pelvic canal. Okay, so if you can get the hips through, then there's a good chance that calf will be deliverable. And the hips are in the birth canal when the hocks are outside of the vulva. Okay, so when you've got the hocks outside, that means when you've got the calf's hocks outside, that means the hips of the calf are in the birth canal, and you've got a good chance of delivery. It can also help to twist a backwards calf as well. You need to do that before the hocks come out, so it can be a bit more tricky again, but you need to kind of try and twist it 45-degree angle and then pull it through the canal. Once you've done that, you want to pull slightly up from horizontal to start off with. And you can take your time at that point, right until the point the tail head of the calf is out. After that point, there is a bit of urgency because the umbilical cord will break after that point. So that's the only time really when you need to kind of speed up and try and get the calf out as quickly as possible after that point. So once the tail head is out, so before that you pull slightly horizontal. Once the tail head is out, you pull in a downward direction. Okay, now moving on to calf resuscitation. You've got a calf. Some calves will receive some form of resuscitation from you, no doubt. Some of them needed more than others, but it's useful to think about the stages in terms of airway, breathing, circulation, similar to the ABC of human first aid. First of all, you need to kind of clear the airway, so establish an airway, clear mucus from the nose and mouth. You can get these aspirators commercially that can help to suck mucus out of the mouth. I would recommend not hanging a calf over a gate for 3 reasons really. You risk injury to the nerve running on the front of the back legs. You risk causing damage and rupture to the bladder because the bar of the gate is going to be pressing directly on the bladder when you're hanging a calf over a gate. And the third thing is, like, holding a calf upside down means that all the weight of its guts, intestine and rumen, is actually weighing down on its chest, and it's just making life harder for the calf to breathe. If you wanted to hold the calf upside down, and it can be useful in some cases, then I would suggest either get 2 people to hold it, for 10, 15, 20 seconds. You can use the calving jack even, use the ratchet mechanism and levering the calving jack up. That's better than hanging it over a gate. And thirdly, you can use a bale, put a calf over the bale and then just lift the bale like a straw bale and tilting the calf on an angle. The next thing is breathing. So a normal calf should be breathing within about 30 seconds of delivery. It's a bit irregular to start off with, but it should settle down. And stimulating the calf to breathe, everybody does some combination of these, but straw up the nose, rubbing the chest with straw, massaging the chest with the front leg, and sometimes the shock of just cold water in the ears and over the head can help. You can also get things like Dopram, which is a drug that goes into the tongue or injected, and that can help. That has success in some cases, and what that does is stimulates the breathing center in the brain. And then thinking about the C, which is about circulation, and specifically here I'm talking about calves which are born with a lack of oxygen and an acidic blood, so acidosis. So a normal calf, a healthy calf, which is not, it should be in the first 5 minutes breathing regularly, should be holding its head up, and should be lying or sitting upright, if you like. And in the first 15 minutes, it should be even attempting to stand up. So that's healthy calves. If it's not doing any of these and it's quite flaccid, it's not responsive, then it could be due to acidosis and lack of oxygen. Other things as well can cause that, if just a tough calving, fractured ribs, septicemia can also be. But in terms of acidosis, you can, in mild and moderate cases, attempt to treat it with sterile sodium bicarbonate that goes into the vein. I would recommend phoning your vet to do this procedure, and it can help in some cases correct the acidity of the blood. Okay, so moving on to colostrum, and coming back to this paper, excellent paper from Edinburgh that Tim has already spoken about. And it's worth reiterating the point, I suppose, that calves which have had no assistance in this paper had the best absorption of colostrum. And then after that, any sort of assistance that was required meant that the paper showed that the absorption of colostrum was poorer. So the best scenario is no assistance and a calf with a good suck reflex that suckles hard for 20 minutes. Okay, so that's the gold standard. That's what you want to aim for. The next best thing, is if you have to assist the calf to suckle for 20 minutes, and a good hard suckling for 20 minutes. Also, it's not quite as good as a calf not requiring assistance, but it's the next best thing. The next best thing the paper found was the tube or bottle feed 3 liters of dams colostrum. Now the point, this is the difficulty here is that in beef cows it's very hard to get 3 liters of a dams colostrum, and it can be quite dangerous. And I'm well aware of that. And you must remember that your safety comes first. This 3 liters dams colostrum can be frozen colostrum. If you are using frozen colostrum, so beware of the disease risk like jaundice of bringing that in. So you need to try and source that from farms which are low risk of that. If you can get some of the dams colostrum, that's good, and you can top it up with artificial colostrum. That is also slightly better. And then finally, the least best option, but certainly better than no colostrum, was the tube or bottle 3 liters of artificial colostrum. Okay, so moving back to the cow, don't forget that you'd quite often have the cow in restraint at this point. So go back, check there's no second calf. Check for, if you can't, check for any tears, if there's a lot of bleeding. I'd highly recommend that the cow gets pain relief. And actually, I would consider giving some pain relief to the calf as well. But the cow, get a bottle of a non-steroidal anti-inflammatory drug from your vet that is ready to go for these cases. Studies, have shown that it makes a difference. It helps them recover quicker. Get some eating, get some drinking, and get some mothering the calf better really straight away. And the last point there, to help, if the cow has been moved to calve her, then it can help with minimizing rejection if you return the newborn calf to the site or where birth occurred. So because the presence of the birth fluid in that area can help with the cow accepting the calf. Okay, I want to plug. I take this opportunity to plug something here. Over the last couple of months, we've been working on these posters, and these have been funded again by the University Innovation Fund. And what they are 2 posters. One is on calving the cow, and the other one is on care of the cow and calf post-calving. And we put them together, with a view to highlight, they're flow charts really, with decision-making points along the way, and they highlight the most important points, in calving and in the time after calving, and on when to call for assistance. And we're very shortly going to be getting these printed out, and our plan is to get these out in the post to as many suckler calf producers in Scotland. So look out for these in the next, at the start of March anyway. And I hope you'll show them to your staff and put them up in the shed ideally, and hope they'll be a useful kind of quick reference guide to you. So. And that's the end of my presentation. Thank you very much for listening. Happy to take any questions, but I'll hand you back to Robert now. Thank you.
Excellent. Thank you very much, Alwyn. And now just straight on to some questions. we've got some absolute belters of questions coming in, and they keep rolling in, so we'll try and get through them as best we can. The first one actually is to the person who hasn't spoken this evening, is Karen. So thinking about, quite often we've calved the cow, you stick her in a pen with the calf's doing fine. What about nutrition for that new calved cow? Should we be offering a pail of hot water, warm water? What ration should we put her on?
Okay, right, good question. I think as soon as the cow has calved, it's a good idea to offer her water and some food as well. So probably not be interested in the food, but I know dairy farmers are quite often give warm water and to encourage the newly calved cow to drink. I think offering water doesn't have to be warm. I don't think in suckler cows is a good idea, and just making sure that after the calf and cow are settled, get them onto a good ration for her to recover and to lactate as soon as possible. I don't know if any of the vets have anything to say about the warm water scenario. I know some of the dairy guys put in like electrolytes or other supplements into them, but I don't really think that's necessary for suckler cows unless there's been a problem calving or she's really struggling to drink or to get back on her feet.
Yeah, they're often very thirsty, and they'll quite often just drink an entire bucket straight away. But yeah. I don't know about the warm water either. Why not? But I don't think it's essential.
Yeah, excellent, thanks. Two similar questions on lubricant. One is asking, is it okay to use soap? And the other one is, if we're using a stomach tube and J-lube, if it's cold, it's quite hard to come through the tube. Is it okay to use hot water to mix this stuff up, or warm water again to mix this stuff up?
Yeah,
So,
warm water is. Sorry, go on, Tim.
When you go for it, Alan.
Warm water is fine, absolutely. And I think you can adjust. You can adjust how thick you make it. So if you want to run it through a stomach tube, then don't make it so thick. And soap can be. We tend to say no to soap flakes because it can be quite irritant to the uterus. So I'd prefer just for you to use kind of lube or powdered lube. That's what I would say to that.
Yeah, excellent. Have you anything to add, Tim?
No, yeah, I completely agree. I just get it in there, plenty of it. It makes a huge difference. Just flood it in there with difficult calvings.
Cool. I'm just struggling to process the volume of questions that are coming in here, so that's all good. What about, there's quite a few questions, similar questions on the cleaning or the afterbirth. What is it okay to allow the cow to eat it? We hear about it's got healing properties, and we also hear about choking and the hazard. So what is the right thing to do with a cleansing? Either.
Yeah, I'll be corrected if I'm wrong. I don't think there's a major hazard to the cow, so I wouldn't be awfully concerned and be panicking if she starts to eat the placenta and that gets rid of it. Then that's that. It's going to happen in a percentage of cases anyway, and I don't think it's a huge issue. When it's not eaten, it should be disposed of carefully, and a couple of the infectious causes of abortion can cycle through the placenta, and the osprey in particular. If that gets into farm dogs that are around, then we can spread that infection around. So very good practice to pick it up and remove it, get it into a bag, get it into a barrel, get it out the way. That's really, really good practice. But if the cow does that job for you, I wouldn't be panicking about that. No, that's all right.
Also, tidying it up saves that incident when you slip on it. Usually there's
yeah, it's really slippy.
Worse than a banana, I'm telling you.
Yeah. Alan, one about particularly about the twist. So this is if we've got a calf that's stuck at the hips, which is obviously probably the worst situation. You've got a live calf that's breathing, stuck at the hips. Is the twist any use at that stage? And is there a best way of actually getting that calf levered round?
Yeah. The two things you can try is you can try doing the twist, and if you can twist it, then that'll probably dislodge it. And the second thing, but quite often it's almost impossible to do the twist once it's hip locked. The second thing you can do is just try and pull to the side as much as you can, so the calves so you're trying to pull the calf as much as you can. I'm trying to think it to the side, and then to the other side, and then to the other side. And that, hopefully, what you're hoping that will do is kind of just get one of the hips from out of the canal. So I hope I'm making, is that clear? Do you know what I'm trying to say? You're pulling, so your calf is hanging out, you just pull as far you can to the right, and you pull as far as you can to the left, and you're almost like trying to nudge it through.
Yeah.
Try to nudge the hip through. Okay.
And see, in breeds where, I shouldn't say that can happen in any breed, but in systems where the big hips or the big backside's a problem, should we be twisting more of those calves? Would the twist earlier in that procedure
Yes,
be
yeah,
advantageous?
definitely. So that's the main benefits of the twist is you're trying to reduce the risk of hip lock here. So if you can, you want to, if you know you're dealing with calves with big hips, then you definitely need to make more of an effort to try and twist the calves, and try and get those calves hips at a diagonal angle when they're passing through the canal. And the other thing is plenty of lubrication, again, even more really than usual.
And I suppose in that situation as well, we're talking about reducing intervention, but there's absolutely a place for that elective cesarean as well, for that if you know it's a significant issue. The Caesar's probably, long term we need to look at it, but in the short term, Caesar in that type of animal is probably better for everybody. Maybe not better for your bank balance, but
yeah, I think you're right. Yeah.
The next one, actually, just moving on to artificial colostrum. So we've got it. There's several questions on it, and we've certainly got the fact that it's not the ideal, but it's certainly something to have in the toolkit. It's a tool that's there to be used if required. But if we are going out to buy artificial colostrum, how do we know the one that we're buying is the best one? Tim.
Yeah, so there is a range, and it's a good question to ask, and you should be careful of it, because it's not regulated here. So the artificial colostrum products don't have a legal requirement to reach a certain level of antibody. So it's worth asking the question. I'm just looking at numbers here. So we are aiming for, in the US, they would aim for 100 grams of IgG per dose. That IgG is the immunoglobulin fraction, so you want to get 100 grams per dose. In the US, they'll insist on that. As I say, there's not that regulation over here, but as close to that as you can get. So it's the IgG level that's in the product per dose is the question to ask, and get the highest level that you can. If there's a range in front of you and you've got an option, you'll pay more. You'll know you've bought one with a higher IgG because it'll cost you more. But if we bring that back into the context of your system, and a live calf and a rapidly growing calf, it's money well spent. And just to re-emphasize the point, if we look at that same level in cow's colostrum, so the colostrum that you might have stored and fridged or frozen from the milky cow that calved earlier in the season, she'll be sitting at 600, 700 units per dose, so substantially higher value in stored colostrum if you have it. But the powder is a good option when your back's to the wall and you just need to give the calf something, and then you want the best stuff that you can get.
Yep, excellent. Thanks, Tim. Alwyn, interesting question here is, what causes malpresentations, and is there anything we can do to prevent them?
I'm not sure if there is anything in particular that I'm not aware of anything any. I think that's right. I'm not aware of anything in particular, that does cause malpresentation. So you're talking things like breech presentations, one leg back, that kind of thing.
I assume so, yeah.
I think some of them is just kind of bad luck. There might be genetic factors perhaps involved. Me, to be honest, I'm not sure there is demand. A lot we can do. Tim, you might have something you can add here.
No, I would agree with that. the only predictable risk factor that springs to my mind is twins, and that is a critical one. You know, we can know and arguably should know which animals are carrying twins, and know then that there's a much higher risk of malpresentation, and maybe we're going for intervention earlier. The other ones, it just comes back to that point about observation and watching that calving cow. If we're not seeing the signs of progress that Alwyn has outlined really well, going in and checking that animal is right. But in terms of preventing them happening in the first place, I think that's beyond us. You know, it's about knowing when to intervene. And a simple, you know, I'm particularly was talking about trying not to intervene with calvings, but when we're talking about straightforward corrections of simple malpresentations, that is a very different circumstance to, you know, a leg back, a head back. Those things can be corrected by a skilled operator relatively quickly and don't necessarily lead to a traumatic or difficult calving. They don't carry the same negative consequences to the cow or the calf or your bank balance as the type of calvings that we've been discussing in detail now. You know, hip lock and walking the hips through the pelvis, and those are really traumatic on cow and calf, and that's where your costs are. So simple malpresentations, difficult to prevent, but if we can detect them early and we can fix them simply, then they shouldn't carry the same level of negative impact as the really hard calving.
Yep, cool, excellent. Next question is, and I think if we can try and keep these fairly brief, yellow mucus in the water bag. Is there any truth that that's a calf that's under pressure? Is that a warning sign? If we see yellow stuff, should we be getting more involved?
That is probably meconium, you know, kind of from the, and it can be, and they usually can pass meconium due to stress, and that would stain, you know, that would stain the birth fluid. And do you need to be? Yeah, I think I would, if that was the case, yeah, intervene. And I would see that as a sign of fetal stress. Yeah, so I think that is I think I would.
And I think the thing we've covered in previous ones, we'll just bring Karen in here as well, is this slow calving syndrome and things. What, briefly, Karen, mineral wise, what should we be doing, or how should we be feeding these cows? For those who weren't at the first webinar, how should we be feeding those cows to make sure we're avoiding that situation?
Yeah, okay. I mean, there could be a number of reasons why the cow is slow, but one of them could be a lack of magnesium in the diet, which is involved in the hormonal role of releasing calcium, which is needed for contraction. So I think if you are getting a lot of cows that are slow to calve or issues like that, please speak to your vet or a nutritionist just to check things out, at the point of when you are in the middle of calving, not afterwards. Yeah, it's definitely worth a check out anyway.
Excellent, thanks. And final question has two parts, part A and B. We've left, probably it's the political hand grenade, so we'll try and end on a high here. And these were the first two questions that came in, and the first question came in, I think it was 4 minutes past 8, so keen to get that question answered. I'm going to leave it till the end. This one is there any studies out there that show what breed is most likely to calve unassisted and suckle unassisted? Every breed says they're the best, but is there any evidence based to these arguments? Who would like that one? Tim.
Yeah, it is a difficult question to answer, and I think we love talking about between breed comparisons. Folk are really interested. We tend our genetic evaluation programs here. They tend to run within the breed, so we can select a Angus or a Charlie or a whatever against one another, but we don't do much cross comparison work. So the short answer to the first part of it, no, we don't really do that cross comparison work in terms of genetic evaluations here, as I am aware. In Ireland they do, so I would give you a wee tip if you're interested in answering that question or looking at a similar system to ours where they do that. Then look at the Irish Cattle Breeding Federation site, and they will list maternal traits they'll list all the bulls available by maternal traits, so calving ease, direct, etc. And that's a cross-breed comparison. So you can go and have a wee squint at that and see where your breed is ranking against one another in there, if you so wish. But I know, because I look at it and I check out that site reasonably regularly, you'll find the majority of our common breeds in the top 10, in the top 15. You'll find Angus, you'll find Salaire, you'll find Limousin, etc., etc. So to me, that re-emphasises the point that it's as much about within breed selection as between breed selection, and any breed can be moved in a positive direction with regard to maternal traits and calf vitality.
Excellent answer. Anything else to add, anybody? The final question, as I say, we've waited nearly an hour to answer this question. So this question is the stabiliser the route to easy care? And I'm going to answer that one myself. And I would say it's certainly a route to easy care. So it's a breed that's selected heavily for calving ease, maternal ability, for certainly feed conversion efficiency as well. So it's a very efficient climate change orientated breed as well. So there's a lot of positives about the stabiliser, but it's by no means the only show in town. You know, there's other, as Tim says, there's a lot of variations within breeds, and there's a lot of options out there using EBVs and increasingly genomics and other tools as well to select what we're really needing to have a productive herd without having a lot of these hassles. So certainly stabiliser, credit to them as a breed, they've done a lot of good work, but there's also other breeds that are available, like any BBC person would say. So would anybody add anything to that? I didn't really mean to take the final point, but with that, it's just after 9 o'clock. So again, I would just like to thank the panel for this evening, and certainly particularly thank everyone who's sent questions. There are loads of them, so we'll do our best to get back to you. And as I say, we're going to get back to you. All the webinar questions will be answered in a winner next week, and we'll present them to everybody. So all the questions will be answered at that stage. Our final webinar for the spring is next Tuesday, same time, 8 o'clock, when we're looking at post-calving, looking at respiratory diseases and scours. So we'll look forward to seeing you then. And with that, I wish you all a good evening and thank you all for coming.